Hi everyone. We have Dr. Nisha with us tonight. Thank you, Dr. Nisha, for being part of the show. Before she comes here, let me introduce you. We'd like to show you her lovely video first.
Hey, this is Dr. Nisha here at my office at Smile Rangers Dental. And here, busy work on a Saturday, and sometimes we work on Sundays too. We help our community, we serve our community to keep happy, healthy smiles. After I'm done with work, this is what I do: change to my other community service. The, it's not just the change of apron, it is the change of the whole person into a leader for the community to help and support, to do a lot of community services, to create more leaders, to make them serve our community for your betterment, for our betterment. So our dream America becomes a dream place forever for all of us. May God bless USA. May God bless Texas.
Hello, Dr. Nisha.
Hi Rashmi, how are you?
I'm good, Dr. Nisha. Thank you so much for being part of the show and giving us time from your such a tight schedule and giving us limelight on how to keep our teeth strong and forever. We would like to have till we have life. We should have them with us.
That's a specialty. Actually, there is sometimes this particular picture circulating in the media where a person is missing one eyebrow and and some part of the lip. But then, like when one teeth is missing,
Mhm.
that's where the smile makes a really very important. Like it grabs the attention. Where is the teeth?
Of course. So, how to get a beautiful smile? First of all, tell me that you have such a lovely smile.
Thank you. Thank you. So, beautiful smile basically begins with actually from parents' responsibility.
Mm-hmm.
It is so important that as parents, we need to make sure that the kids' teeth they do not have a lot of habits. So when they like the pacifier, make sure that they use an orthognathic pacifier,
Okay.
which is like an orthodontic pacifier.
Mm-hmm.
Some brands they do not displace teeth. So when the pacifier is used, it has a more of a broader space, a flatter projection. So we can use that. And many a times it's better not to use a pacifier, but then it's okay if they use a pacifier, but then use the orthodontic, the dentist specific ones. So that way, there is not much of the malpositioning of the teeth. So, and then when the kids grow like habits, thumb sucking,
Mm-hmm.
what thumb sucking does is a lot of parents ask us, thumb sucking, my kid thumb sucks, what are my options? What do I do? So try to talk with them and try to see if you can prevent the habit. And habit correction is very important. That way, a lot of kids, if you see the protruded teeth, they protrude outside because of the pressure of the thumb. This particular part of the thumb, where actually they put the pressure on the palate, and when they keep sucking and sucking, and this pressure will disfigure the whole hard palate. And so on the top, the palate gets disfigured, pushing the part of the upper tooth forward. So when they are going to go on the side, the profile is going to be really outside. So that we call it as a side profile, and we sometimes call it as a bird feces, bird face like. So we want to make sure that you don't get the bird face kind of profile. So when the parents can monitor and then bring them to the dentist, and we can refer them to an orthodontist as soon as possible because we can help some growth modification devices and things like that. Because if the habit is disfiguring it, sometimes naturally itself the jaw is not growing properly, so there are so many growth enhancing appliances available. So the general dentist can assess the patient and the kid, and then we can talk with them, and then we can send them to the orthodontist. And so when the orthodontist can assess the patient, it can do metal braces,
Mm-hmm.
and or they can do like a phase one and a phase two. A phase one is an they do some arch expansion, because if there is a lot of crowding of the teeth, then and the arch, the upper arch, the alignment. So when the teeth has to be like aligned really nice and very nice. So if the teeth is not aligned very well, then it looks very not pretty. So we can have the arch expanders where the teeth is not crowded on top of each other, and the orthodontist will actually decide when to do it. They do a lot of scanning and cephalometric radiographs and a lot of other stuff, and then they can provide them with that phase one of the orthodontic treatment, and which will be like a metal braces plus some other appliances to it. And once phase one is done, after some time they do the phase two therapy. And so that way they have the kids at the almost close to their all their permanent teeth are there. They get a very good smile, a very aligned, pretty smile like that. You know, how many of us dream to have a beautiful smile like that, right?
Of course.
Um, so the clear braces is something is a more fancier now,
Mm-hmm.
because you don't have to go through the ugly metal portion of the braces anymore. And nowadays there are different brands, and doctors they promote different brands based upon their comfort level and their results. And we get really good results comparable to the metal braces in many patients with just clear braces. And it is very helpful, and it's very easier, and a lot of patients prefer them because it's clear, meaning there's no metal on the top of the teeth.
Mm-hmm.
And even orthodontics, a lot of them, the orthodontists themselves, the specialists, they give a lot of these clear braces to the patients, and it gives them a very pretty smile. And some can be like 12 months. There are also limited braces, and there is another technology where they wear the clear braces and they use another activation device, and which actually propels and increases the speed of the clear braces. So there is a really a wide variety of options in available today, and that gives them to choose. And we have like the before and the after pictures. We scan the patient's mouth and teeth, and then we can show them this is how it is going to be before and this is going to be after, so the patients can decide which phase they want. And many a times the patients tell us that, okay, I didn't like the plan A, I like the plan B better. So we sit and discuss with the patient and we give them that type of a smile what they want. So basically they design with us and they plan with us the final results. And it is a process. We work with a patient and we get the best results for them.
That's awesome. But just tell me, doctor, the procedure of this braces, it is a painful procedure, or how is it like? And how many sittings is required for that?
So the metal braces, I mean, basically, braces or clear braces is really not painful. The
Okay.
most painful treatments would be the root canal treatments or surgical extractions or the wisdom tooth removal. Those are the really difficult ones. Braces, any kind, is always very easy. They
Mm-hmm.
don't really hurt, and it does require a lot of appointments. That is for sure, because it is it goes through, some people have like every 2 weeks, some have monthly appointments. In clear braces we do 3 weeks, every 3 weeks or every 2 weeks. We give them treatments, and we bring them in, we try their old aligners to see how they're fitting, and then we change it to the new set of aligners.
So after they have the braces, is there any precaution they have to take, like anything like while eating, or it's just a regular thing, like
So the basically after the, I mean, are you asking about during the treatment or after the braces are done?
both the thing, like after the it's been set, then
Mhm.
is it everything regular, normal, or they have to take precautions?
Yeah, so for during the wear of the braces, retainers, the regular aligners. So there's two things. One is the aligners, and the
Mm-hmm.
other one is the retainers. The
Mm-hmm.
retainers are the ones, they are transparent trays, and they are actually worn 22 hours basically. We just tell them don't wear just 2 hours
Okay.
while you are eating and just little relaxation.
Okay.
So they basically wear it for 22 hours, and the treatment phase can run anywhere from 6 months to a year. There are some limited braces available for minor corrections.
Mm-hmm.
That can be less than 6 months, but it still is very dependable. Minimum, at least, we need 6 months or 7 months to do a minimum correction, very minimal. But overall, they have to keep wearing their aligners, and many of them they lose their aligners. So that's something we call it as, okay, we first of all, they should not lose their aligners,
Mm-hmm.
and it's metal braces, it's there in the mouth, they're not going to lose it.
Okay.
But this one, they can lose it.
Okay.
And then the retainers are something that's worn after the clear aligners are removed, and then they just give them the final retention. Because all the hard work we do to keep the teeth in place, it shouldn't be lost. So what we do is we kind of tell them that to keep their retainers on. The first year, we try to have them wear as much as possible in the morning and the night, and for sure during the night.
Mm-hmm.
And then the second year also, we try to tell them to keep wearing them during the night because it's very important. The moment they stop wearing the retainers, the teeth can relapse, like they can start moving apart.
Okay.
So
Thank you
all
so
the
much, doctor.
space.
It's really great to know about all these things. It really help.
Hmm.
Because and I think so people avoid going to dentist still. So it's going to be a great help because you always make everybody feel so comfortable and make them at ease. It really helps. Otherwise people feel scared. Oh my god, what's going to happen? Oh my god, we have to keep our mouth open.
Yeah,
How it's
so
going to be so
basically,
painful
whenever they see,
you know
I know, I totally understand.
Yeah, thank
They
you
see me,
so
they
much
scare
for
away.
sharing your knowledge. It really helps. So let's
Yes,
play the scanning video.
sure, sure.
Smile Ranges Dental has bought its new scan from Carestream. And we have Miss Courtney here helping us. And look how hi-fi on the scanning, and so we are actually making our patients more comfortable by not anymore using impression materials as much as possible. We are going to be all high-tech. Smile Ranges Dental is transforming into a high-tech dental office. We already have a CT scan. We have all the digital sensors. Now we are going into the 3D scanning. Soon we will be updating with 3D printers too. Please welcome to Smile Ranges Dental, the state-of-the-art high-tech office.
Awesome. Thanks to this advanced technology. Please give us some limelight on this digital scanning, doctor.
Sure. So nowadays, dental offices are becoming fully digitalized,
Mm-hmm.
meaning that we try to do a lot of procedures utilizing technology.
Mm-hmm.
Scanning is the biggest one, and we also have the 3D imaging with CT scans. And the video you just saw is a intraoral scanner. We take intraoral pictures nowadays, and it is so easy. And we record also a lot of pictures, and we show them how a lot of things can be done in a very easy way, and it helps them. And what are the problems and the defects in their teeth? It's very clearly shown. Say, for example, in an intraoral picture, like I wanted to show you this part. So this is a picture of a patient like whose tooth is broken. And
Okay.
so on this one, if you see, that the patient's tooth is broken, and then we take a picture and we show them. We also do an intraoral scanning, and we show them what has happened to the teeth. And then if you really see on the bottom, we
Mm-hmm.
have replaced this patient's teeth with a crown. So
Yeah.
that one, so that is a tooth with a crown picture.
Mm-hmm.
So, and then now we're gonna go show you another one, which is a bridge. So this is
Okay.
a metal bridge,
Hmm.
and so basically the patient lost all her front teeth, and this is the metal framework that goes under the bridge on this area. This
Okay.
is the teeth that is lost, and then after that on this side we have the metal framework, and then once the framework's done, and that is the full smile of this patient. So we can basically
Wow.
replace a lot of things, a lost smile. Look at this one. This one's amazing. This is my favorite.
Mm-hmm.
She has no teeth at all. No
Okay.
teeth on the
Mm-hmm.
top
Yeah.
teeth. And look at this one. Look at her smile.
Oh my God.
So
What?
we can do a lot of stuff with digital dentistry today. So what we do is we scan their teeth, and some patients cannot tolerate the materials in the
Mm-hmm.
mouth, and they have a high gag reflex. And then you go put the material in the tray in the mouth, and then you go like, yep.
Oh my God, really?
So it's hard. So some patients can be gaggers, and having the material in the mouth, say for example, when they open their mouth,
Mm-hmm.
and then you're gonna insert anything. Like you see, I have a little light.
Yeah.
Then I go like try to put this, and then they go like up. I can't.
Oh.
They get fear.
Mm-hmm.
So what happens is we try to explain to them everything, and then the scanner tool is very easy. So
Mm-hmm.
all we do is we have them open their mouth, and then we just go on and scan very quickly and easily like that, and then everything gets recorded into your computer screen within
Fantastic.
minutes. In less than a minute, you can actually scan the upper arch. In 3 minutes, you can scan the whole of the top arch, all of
Wow.
the top arch, all of the bottom arch,
Mm-hmm.
and then you can even make them bites, and it will all be recorded in your computer screen in minutes.
Wow.
So it's very easy, state of the art, and in the long run, every office will become digitalized. We invested on a scanner this year, and we started using this for our patients. I had a little girl who we could not take an impression on her.
Okay.
So we took an impression, and then she literally vomited during the process. But when we used the scanner,
Hmm.
she was like, "It looks like a video game."
Oh.
And so she started taking it in her hand. Of course, we hold it, and then we showed her, and she felt really wonderful seeing that whole teeth of her teeth inside the screen. And she was like, "This is so easy." So it has a complete transition, and it helps. And that's why implementing a digital technology into the dentistry has a great view, and it's very helpful. And so basically, when you were talking about the smile corrections,
Mm-hmm.
so some of the things like I showed you on the pictures of how the patients lose the teeth, and then we correct their smiles.
Yeah.
And then we have the smile braces that helps to correct the smiles. And another important thing I wanted to share with you is also making the smile prettier with these type of products. And here I am trying to promote our product, our all made in America product.
Okay.
And these are take home tooth whitening trays. And this is like a real blessing for people who have sensitive teeth, and they're so afraid to make their teeth whiter, because all of us want like a beautiful white smile.
Of
This is
course.
like our real dream, to get like a beautiful pretty teeth and smile.
Of course, there's a standard statement, "Moti jaise daant hone chahiye." It's looking like that. You know,
Yeah,
that's what I feel.
Motivated sons, yes. We want the sparkly teeth, and I used to actually start all my speeches in the dental seminars and schools, like, we want teeth shining like stars. Like I used to say, twinkle, twinkle, little star. How I wonder what you are. How is about my smile? So
Awesome.
that's what I always try to tell them, that, of course, we can make anything and everything possible with digital dentistry in today's world. We can scan, and we can even the digital dentures, the dentures we have on this picture. These were like digital dentures made with the digital technology, because the thing is, the smile is very natural, because the scanner records all the lip tissues and the
Okay.
color. Everything is just printed, 3D printed in today's world. And it is absolutely very natural.
And how popular is Smile Collection in Bollywood?
Bollywood is fully on smile correction, and I Aishwarya Roy. It was like, they always say that Aishwarya Roy had a lot of these, but we don't know. But that's just always like, they say Aishwarya
And
Roy
even
is
Madhuri Dixit,
famous.
yeah.
Of course, Madhuri Dixit, a lot of them, like everybody gets tooth whitening or some kind of dental work, or like, correction, smile correction. It's like a smile makeover. Yeah, and
Yeah,
then
of course.
that just gives
Right.
that sparkly smile. Yes.
So, can you please give us again some tips on how to brush? Because a lot of viewers have been calling and asking us, like, please ask Dr. Nisha, how should we brush our teeth? Still, we are confused.
So, before we go into the brushing, first I wanted to talk to you a little bit about white coat syndrome.
Okay.
And so, white coat syndrome is something like whenever the kids see the doctors in the white coat,
Mm-hmm.
they remind about their vaccines.
Okay.
So they freak out.
Mm-hmm. True.
Oh no! Okay, I don't want an injection. No. So it's like, we are like the most unwanted list in their mind. So we try to incorporate everything pretty pink. For the girls, we try the light, which is like pink light, and then we have pink stat. My daughter thought like this stat was like, oh, mommy, is this for my play kit? No, we try to make them at ease, like a Barbie doll kind of, like, and there's a lot of scrubs nowadays. We wear like maroon and designer,
Yeah.
so we try to blend with the kids. And then we try to play with them at the office, and we keep the office in a very beautiful setting, so that way they feel at ease and at home,
Yeah.
and they smile more and better and have good memories.
Sure.
So in my office, my range is dental. We have a setting of more of like a ranger style, like a Texan, more Texan. There are some offices that is set up like an ocean style. I have one of my friend doctors, pedodontists. His whole office is set up like a flight, and so they dress up like air hostesses and things like that. So now, and also we try to teach them brushing, and that is our first and foremost thing. So when we teach them brushing, and this is what we go. So when we just try to make sure, tell them start from the top and go down, and more vertical strokes. Number one, it has to be all vertical
Okay.
strokes.
Mm-hmm.
And then after that, we for the kids,
Mm-hmm.
rolling method. Okay, so we roll. So let me try to angulate it to my camera. So we go roll. So this is for the kids. 2 minutes, roll, vertical roll. If they use a mechanical brush, the power brush, so they do this part, okay? And then when we, as adults, we use a modified bass technique. And what we do is we try to keep the brush at an angle close to the gum line. And then we go top to bottom at an angle. And this is called the modified bass technique. So when we go like this, we need to make sure that we start from one side and then go in, go brush, go down, go brush, go down. So that way it's more like a vertical strokes. If you see normally what people do is they do this. This is wrong. This is really, really wrong. Don't do that, because what happens is it removes the enamel from these parts of the close to the gum line. Say if this is the gum, it removes the enamel. It called abrasion, because the brush, we ourselves take our enamel, spoil our enamel with wrong brushing. It's very, very important. And use more of a medium brush. Do not use very hard brush, and use the toothpaste that is more softer, or like, less abrasive, and look into the abrasive content, and that actually helps. So we go kids, roll, 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 rolling method. And then when we go on the adults, it's modified bass, and then we use a downward stroke, go up and down, and the modified, it's called a modified bass. We go a downward stroke close to the gum line. So that's how we try to brush. So that way we teach them, and we teach them to floss, because flossing is also very, very important. If you do not floss, there is no way the food that is stuck in between the teeth is going to go. And a lot of times patients use toothpicks and pick at them, and it's going to damage the gums. So it's very, very important do you use a floss. So if you use a floss, and there's a lot of YouTube videos on how to use the floss, and it's very helpful.
But when they use floss, their gums start bleeding. That's also a common problem.
Yeah, so what happens is when they use floss, if the gums are already inflamed, then it is going to bleed. And if they're using the wrong technique, it's going to bleed more. So maintaining a dentist appointment every 6 months in a year, that will keep the gums healthy. And then using the right flossing technique, it will prevent gum bleeding. And there is also floss picks. You can just get them in Walmart or Walgreens, and those are like they come in a bag of 50 or 100, and you can use floss picks too. Only thing is when you use the floss picks, go in and then go to come down. But some people do it as a seesaw motion, like don't go like seesaw, seesaw, then it's going to damage your gums. It's very important that you go in and with the floss pick and then come down a little bit. And if you go, don't do like this. So if you're going to go do like that, yes, it's going to damage the gums. It's very, very important. Yeah.
Yep. And one more question, doctor. I have met two, three people last week, and they had a lot of problems because same problem. What they told me, like while taking out their wisdom tooth, their nerve got cut, something
Mm.
like that, and one of the girl, she's not even able to open her mouth and speak properly. So what is it about? Like if it is not able to, why do doctors suggest them to take out the wisdom tooth, and or just not leave it just like that? If it can be a big major problem, it can turn up into a big major problem also, right? So
So
please give some limelight on that kind.
sure, sure. So basically, wisdom tooth can create issues for the other teeth. So you want to make sure that the wisdom tooth has to be removed if there is no space. So if there is enough space for every tooth in the mouth, there is no need to remove the wisdom tooth. But then, if there is not enough space, the teeth are not aligned right, and they're crooked, they're crossed, one tooth is leaning on top of the other, then the cavity forms in between the tooth. So
Oh.
that is one of the reasons we tell them to remove the wisdom tooth. So while removing the wisdom tooth, yes, it is a very difficult surgical procedure. It's not easy. There's a lot of bone that needs to be removed from around the tooth to take this tooth out. And sometimes the nerve is close to the tooth and it can get affected. So that's one of the reasons wisdom tooth needs to be taken out as earlier age possible. Like I said last time, it's more better than during the teens than at an older age. So when you talk about the nerve got cut, actually it can get cut. Even for myself, when my professor was taking my wisdom tooth out, my lingual nerve had happened to be got cut. So I did not have taste sensation for my half of the tongue for a very long time. And I used to tell my mom, if you're not going to cook well and it's not going to taste good, I'm going to push it to my left side of my mouth. That's what I used to tell her. So it does take time a little bit to come back. So it does like time to take comeback, but then once it comes back, usually you'll get your nerve sensation back. But it is very important that if the nerve is cut, you need to get to a microsurgeon to get it repaired. A neurosurgeon, so your dentist will refer you to, or the surgeon will refer you to the neural surgeon, and a microsurgical repair can be done, and then the nerves can be fixed. Sometimes it cannot be fixed, but then with the time it can be anastomosed from the nerves from the other side, which happened to me because I didn't get the neural surgical repair done, but then it was long time ago, and I wasn't really aware of that. Now there is more awareness about it. So, but then once you get that anastomosis from the other side, then the taste comes back, or sometimes the sensation comes back. So that happens. Regarding the swelling, it really swells up bad. So the whole side, wherever the wisdom tooth is taken, it can really swell up bad, or like you'll have like a
Okay.
you're gonna have that. But it's just for 2 or 3 days. We do try to give them some medications to reduce the swelling, like anti-inflammatory pills. But it is a part and parcel of the game. It does swell a little bit, but
I
we're
know.
gonna have a little bit of a chubby face for a couple days.
I know. Thank you so much, Dr. Nisha. It's so awesome to have you on our show and giving us tips on keeping our tooth healthy and what all precautions we have to take. So many people have told this is our favorite show. And
Oh,
I always tell them, Dr. Nisha, she is super talented. She is
thank
not
you,
only a
thank you.
dentist, she is into fashion field, she is working for women empowerment so much, she's supporting everyone. And we are super excited for your upcoming show, We the Women, right?
Oh, sure, of course. I'm really excited about this whole show because it's all we the women and we the empowered women with the super empowered women, Rashmi Bedi, my
Thank you, Dr.
favorite.
Nisha. Thank you. It's really great to have you on our show, and we are thankful to you, I should say, heartiest thank to you. And it makes me feel so happy. I feel a lot of people are there who cannot visit doctor because, of course, dental and eye is so expensive. But these tips, sitting at home, they can listen to your tips, and it will be great for them, because
Sure.
as you know, tooth are so important. We have
Thank
to
you for
take care
providing
of
us
our
a
teeth.
platform.
Thank you, Dr. Nisha. Thank you for being part of the show. Thank you so
Thank
much.
you, Rashmi. Bye bye. Take